Pleased to say that we've only had 2 new cases overnight, which have been overseas acquired and are in hotel quarantine. We now have 55 active cases in Queensland, and I want to thank everyone who came out and got tested in the last 24 hours. We've had 5,308 tests. We've also had over 3,100 vaccinations yesterday, so we're now over 112,000 vaccinations. And again, I encourage Queenslanders to continue to come out and make their bookings and get their vaccinations. Sadly, I have to inform that we have had one gentleman who has died overnight from COVID, who was being cared for in our hospital system. This gentleman was from the Philippines, and I'll pass over to Dr. Young to provide a bit more detail, but we do want to pass on our condolences to his family and his friends at this really difficult time. This is another reminder that this is a deadly virus, and that we are still seeing thousands of people around the world on a daily basis dying from COVID. So this reinforces the importance of the vaccine rollout and making sure that everyone who gets the opportunity comes forward and gets their vaccine when it's available to them. I'll pass over to Dr. Young just to talk a little bit more about this gentleman. Thanks.
Thank you very much, Minister. Yes, I have some sad news to announce today. A gentleman in his 80s died late yesterday from complications from COVID-19. So he returned to Australia from the Philippines on the 20th of March, tested positive on the 25th of March, was admitted to the Prince Charles Hospital for care, and then passed away late yesterday. So that is, of course, very sad news for his family and his friends. Now, as we go forward, that reminds us of the importance of everyone, when they're able to and when the vaccine is offered to them, to go out and get vaccinated. So I'm in the over 50 age group, so I will be, as soon as I'm able to be and it's offered to me, getting the AstraZeneca vaccine. That's really important. There is the new advice going forward, of course, that anyone under 50 should preferentially be offered the Pfizer vaccine if it's available, but it doesn't stop people getting the AstraZeneca vaccine if they're under 50, and they feel that their circumstances are such that they would prefer to immediately get vaccinated rather than wait for the potential to get the Pfizer vaccine. But anyone who's 50 years of age or over, and when they're offered the vaccine, because they're in the relevant priority group, they should be vaccinated with the AstraZeneca vaccine. That's very important.